Statewide, tests have been coming back. Around 9% of tests are coming back positive, but that's a lot higher in places like Yakima County and in Benton and Franklin counties, where the Tri-Cities is. They report back 17% of tests that are coming back positive.
Hi, I'm Scott Leadingham. Thanks for joining us here in the unique Northwest. And it certainly is unique, as we are all well aware by now. I'm not in the studios, as very few broadcasters are at the moment. We are at home, and I have a makeshift scene behind me that is moose and trees of the Northwest. Hopefully it's a nice Northwesty feel. And we are also joined by a reporter of the Northwest, Courtney Flatt. Thanks for joining us today, Courtney.
Thanks for having me.
So Courtney has been out there reporting on the COVID-19 crisis, and not, although sometimes from her home, mostly from her home, not out and about. And so Courtney's going to talk a little about what she's been seeing and reporting on in the Tri-Cities and around the region. So Courtney, first of all, a few things that of note in terms of businesses that have stepped up and people that have donated a few things and are helping out in the effort. Tell us a little bit about what's happened there in the Tri-Cities and in the Moscow-Pullman area.
So in the Tri-Cities, Battelle, which is Pacific Northwest National Laboratories parent company, is donating more than $100,000 to area food banks. One of the biggest donations went to Second Harvest in Pasco, and that's because they reach so many people in the Tri-Cities area. They're also donating to food banks and Meals on Wheels programs in Prosser and Sequim. And another kind of cool thing that they're doing is, because the lab isn't hosting events anymore right now, they're hiring out the caterers that would normally be at those events and getting them to deliver meals to first responders. And I think they delivered something like 200 meals the first week they were doing that. So that's kind of cool. And then in the Moscow area, there's a company called Northwest River Supplies, and they are distributing 30,000 respirator masks and other personal protective equipment. And typically what they normally do is they will distribute rescue equipment during flood emergencies. And so when they saw this great need for personal protective equipment, they reached out to their distribution networks all over the world, mainly in Asia, and are now being able to distribute supplies and help manufacture medical supplies. And so they're shipping all of the stuff from Asia, and it's kind of and it's in great demand, and so they're spoken for pretty much before the supplies even leave the factory floor. And first they're going to distribute respirator masks to first responders and hospitals in the Moscow area and in Idaho and Washington. And after that, they're going to start distributing elsewhere. When they first announced that this was all happening, they even had requests from California, from all over. So it's a great need, and they're helping to fill that.
Okay, so speaking of getting ready for things and trying to anticipate the need for emergencies and the like, Northwest fire season is, of course, upon us, as it is every year around this time. And with a little bit of a twist, though, firefighters are not able to train or prepare as much because, well, you guessed it, because of the coronavirus. Tell us a little bit more about how agencies are dealing with that.
Yeah, so predictions are that this year, fire season in late July and August could be pretty severe. And so to prepare for that, normally what would happen is there would be big fire training camps around this time of year. The Department of Natural Resources usually holds them in April through May. And new and old firefighters get together and they kind of learn skills. The new firefighters learn things like spinning weather and all sorts of stuff. And the more veteran firefighters gain leadership skills. But the problem is they're in these like really tight quarters. They're camping together. They're eating in mess halls. They're in these classrooms that are really kind of close quarters. And so that made social distancing pretty impossible. So whenever Governor Inslee came up with the stay home, stay safe order, DNR pretty quickly canceled the fire camps. And so that's also going to be a problem actually on the fire lines. People are like maybe a foot apart sometimes. So DNR is trying to come up with solutions, getting fewer firefighters to be in the same engines together. They're not really sure now what's going to happen, but they're coming up with a plan, and that should be out soon.
All right, well, sticking on the fire topic, not necessarily related to coronavirus, but There is some recent research out of the University of Washington that you had reported on about climate change and the continuing threat of wildfires in the region. What's in that research?
The big takeaway from that research was that we need to prepare now for really intense and longer fire seasons, especially east of the Cascades, where we have lower elevation ponderosa pine forests. These ecosystems are usually used to fire and they need fire, but they don't need these really high intensity, really frequent fires that will come through as the climate warms. And so what we can do to prepare for that is kind of stuff that we've already been doing. We just need to keep doing more things like forest thinning, more prescribed burns, and that helps clear debris off the forest floor, these fuels that help these fires grow really, really large. On the west side, there will be more fires, but they won't really be any bigger than what we're seeing right now. And the kind of interesting thing there, though, is that we can't actually do much forest thinning. These researchers say, if you picture the Olympic Peninsula, there's debris all over. And so you can't thin as much as you would on the east side of the Cascades. So what they're saying there is that people need to just be more fire wise and live more fire smart. Stuff that we've kind of been doing on the east side of the mountains, or people have been trying to do. So that's all going to kind of change this season. The Forest Service has actually put its prescribed burns on hold in Washington and Oregon on national forest lands. And that's because they didn't want to put extra smoke in the air that could be harmful for people with respiratory illnesses. These people are already in the kind of susceptible group for potential problems with COVID-19. And so a lot of these things that would normally happen to help keep forests healthy are just going to have to be put on hold for a few months.
Well, it's all good information. We thank you for sharing it with us today, Courtney, and stay healthy.
Thank you. You too.
And we turn now to reporter Enrique Perez de la Rosa in Yakima. Thanks for joining us today, Enrique.
Thanks for having me.
So, Enrique, generally we want to hear about what's on the ground there in Central Washington, Yakima Valley, Tri-Cities, Wenatchee region. And we're not going to talk specifically about numbers because those change day to day and frankly, hour by hour, but situationally, generally on the ground, what's been happening?
So the number of cases is rising every day, and like you said, every hour, and that's pretty much happening everywhere. Health officials are not saying that this is slowing down yet, and quite the opposite. They're saying that April is going to be the worst month for a lot of these places. But it's important to note that that's not affecting every place equally. It seems that the pandemic is really concentrating in certain areas of Eastern Washington. And one interesting measure of that, if you do allow me to get into one number, is the percentage of positive tests that come back to counties. Statewide, tests have been coming back. Around 9% of tests are coming back positive, but that's a lot higher in places like Yakima County and in Benton and Franklin counties where the Tri-Cities is. They report back 17% of tests that are coming back positive. And that's a lot higher than in a place like Spokane and even in King County. So that does mean that it seems the pandemic is concentrated in Yakima and the Tri-Cities. But it also means that testing is concentrated on vulnerable populations because resources are limited. And so these places want to get ahead of the pandemic and know how many people who are vulnerable to COVID-19 are affected.
There are two things of note for the Yakima area recently. The hospital that formerly closed, run by Astria Health, that is now reopened under state and federal guidance. Is that just out of an abundance of caution, or is that a perceived future need for things to get worse? Like, what really is behind the hospital reopening?
The Astria Regional Medical Center, it closed down in January. And even then, before we even knew what COVID-19 was here or in China or anywhere, hospital officials here were really worried that one hospital was not going to be enough for a city as big as Yakima. And so when COVID-19 began showing up in Yakima County, health officials were even more concerned. In fact, the remaining hospital, the officials there asked people to stay home even before the governor or the health district put in stay-at-home orders. And they said that by the 8th of April, that hospital was at risk of being completely overwhelmed with COVID-19 cases. So yes, health officials are saying that things are going to get worse in the coming weeks, but now because of these federal resources, they feel that they are much more prepared for that peak, which in Yakima County they're expecting in late April. But that doesn't mean we're out of the woods yet. One huge need that we're seeing nationally and across the world is the need for personal protective equipment, and Yakima is no different.
There is, of course, a big Latinx and Spanish-speaking population in the Yakima Valley in central Washington. And I just wonder what sort of things are being done to address the needs of Spanish speakers, be it students who are now doing distance education at home or just others in the region. What sorts of resources or organizations are stepping up to fill that critical need for communicating with those audiences?
This is an issue that health districts and school districts are aware of, and they are, doing all they can to disseminate information in both English and Spanish. They're releasing press releases, posting information on their websites in both languages. And the Yakima Health District has actually been hosting press conferences, first in English and then another one for the Spanish media. But the problem with that, and again, it's something that health districts seem to recognize, is that there's not a lot of Spanish media despite the large population of Spanish-speaking people. And the consumption of media by the Latinx community is not always online. And that's because, a lot of migrant populations or newcomers to the country often don't have access to the internet or devices that can access the internet. And they often just prefer traditional broadcast media or print media. So where does that leave the health district that wants to reach this population? Well, they are turning to organizations that already have a very strong connection with this community. Organizations in the Yakima Valley, like La Casa Hogar, Nuestra Casa, which normally they host classes to teach English and citizenship classes for people in the community. But now they're, like everybody else, they're transitioning those classes online and are on top of that trying to figure out how to disseminate information about COVID-19 to that community that's local and that's accurate and that's relevant to their needs.
Well, of course, it's always good to be informed, no matter what language you are communicating in. We thank you for sharing this critical information with us today, Enrique.
My pleasure.
You can read more about these and other topics at our website, NWPB.org, and you can see more coronavirus updates in English and Spanish while you are there. Thank you for joining us, and stay home, stay healthy out there in the unique Northwest.